I joined the sounding board because our daughter has a very rare genetic condition. She's also got a learning disability and would struggle to speak up for herself. So although I'm not as good as her at expressing myself, I feel I am able to partly be her voice. And one of the main things I have felt proud of in terms of working with the sounding board is actually helping with the design of the new premises from the perspective of bringing along a young person who struggles in waiting rooms, who maybe would upset other people or distract people. And I feel that my voice has really been heard in terms of what's needed to keep young people like my daughter calm and occupied while they're waiting to see a geneticist.
I've always been highly involved with PPI, involvement of patients in making decisions, and I can honestly say that joining the sounding board has been amazing, and I actually do feel as if we do make a difference. Every conversation that is heard is all looking at the patient experience, and I can honestly say that is the core of everything they do. I particularly enjoy being a member of reviewing the development of the estates. I have a son who's autistic, so I understand it's not just the clinical environment that's important, it's the ambience of the place, and it's to be suitable for not just the patient, but also their families. But it gives you a true picture to clinicians. So I think it is so important that people are encouraged to join and to give their experience out, and that the information of the work of genomics reaches out into communities.
Having gone through that over that period, I really felt that if there was a way I could give something back to the National Health System, which would basically save my life and give me some chances to enjoy some other things. So I looked around on the internet and came across the patients group. I think we as a group were made to feel very, very, very comfortable and sort of told that we'd be working in a very safe environment, that we could say what we wanted to say without embarrassment. I've grown in terms of knowing what genomics is about, although I'm still only in basic knowledge, but I certainly understand that the benefits it will bring to the Welsh public. I mean, it's quite phenomenal that things that it can find that have taken years, of investigations, and it can be found probably within a week, which is amazing. I would just love to have this service up and available tomorrow. The more diverse the people you bring into a sounding board, the more ideas you get, and it's certainly the way to go forward. One person's ideas is not enough, and one person's experience is not enough. It really does require it across the board.
We all go to hospitals. We all have to use health services at one time or another. At some point, we may have to use some of the services that we've been talking to through consultations. We might not, we might never. But knowing that you're listened to and that you're making a difference for people who may use those services going forward, it's really powerful. I am a bit renowned for putting myself forward for things and wanting to help. So I thought, well, let's just find out. So I followed the links, found out a bit more, filled in the form, and I got a call. And I was a bit worried, a bit nervous, because I didn't think I knew enough about genomics and the sorts of things that might be talked about. But my mind was put at ease. They weren't looking for experts or specialists or professors, because we've got enough of those and they do a brilliant job. And what they wanted was people like me who maybe had a bit of experience or was just interested in getting involved. We don't need specialists, we don't need experts, we just need people, and that's all we are. We have our say, we get plenty of information, and it's nice, it's friendly, it's inclusive. Come and join us.